All right, and we're live. Welcome and thank you everyone for joining us. We have been investigating hypertension recently, and this is basically the summation of all of our thoughts, key mechanisms, pathology, and what you can do about it. So without much further ado, we can dive right in. If I find the right key. All right, Wafa?
Great, thank you, Tyler. So first off, we're going to start off by just knowing how we define hypertension. Hypertension is a chronic medical condition where the force of the blood against the walls in the arteries is consistently high. This becomes a problem when it's long-standing because this high blood pressure in the vessels can lead to complications at a cellular level and then to the tissues and organs of the body. So what is the frequency of hypertension in the US population? Well, it's actually quite high. Nearly half of the adults in the US, about 47%, or 116 million people, have hypertension. This is defined as a systolic blood pressure of above 130 over diastolic blood pressure of 80. The values can change, but the standardized values of 130 over 80 gives a very high proportion within the US population. So hypertension has a couple of types. Conventionally, it's classified as either primary or secondary. Primary is also sometimes known as essential hypertension, and this really means that we don't know what the underlying cause is, at least in conventional medical literature. But there is more and more evidence showing that actually other things might be playing a role. Things like lifestyle factors and environmental factors may be playing a significant role within these primary essential hypertension cases. In terms of secondary hypertension, that means that there is another organ that is involved, often the kidney, sometimes the endocrine system, or the RAS overactivation system, which we'll talk about in more detail. The vascular disorders can also lead to hypertension, and in some cases it can be drug-induced. So whether it's primary or secondary, hypertension can, again, cause complications in the body, but really knowing if there is an underlying organ cause can be quite significant, because it can have a slightly different treatment plan for individuals. In terms of etiology for hypertension, especially when we're looking at this essential unknown causes, well, lifestyle factors play a huge role. A sedentary lifestyle and lack of physical activity can contribute. A diet can contribute greatly, especially a high carbohydrate, highly processed diet, when it's combined with high fat, really can lead to a number of different mechanisms, which we'll discuss, that can give us this picture of hypertension. Other factors of stress in the body, particularly oxidative stress, can also lead to hypertension. Things around cigarette smoking and air pollutants may damage the blood vessels, and again, causing this picture of elevated high blood pressure. We can also have psycho-emotional stress or sleep disturbances. These can cause temporary elevations in one's blood pressure, but when prolonged and chronic, can lead to this picture of chronic hypertension and just the same sort of impact in the body long term. And some drugs have also been known to cause elevation in blood pressure in women taking the oral contraceptive pill. A number of studies have shown that that could be an independent factor for elevating a woman's high blood pressure, hypertension in the body. Steroids and even licorice drinks or extracts are also found to kind of create this sort of relationship of elevated blood pressure. In terms of mechanism, we've got a few mechanisms, but Gábor, I think we'll start off with the first one.
Yes, thank you. I believe that the basic or most common mechanism of hypertension development comes from the overconsumption of refined carbohydrates that causes chronic low-grade inflammation and chronic hyperinsulinemia. This hyperinsulinemia then can induce an imbalance in metabolism and eventually leading to chronic insulin resistance, which in turn can increase sodium retention by the kidneys. That's the most common mechanism. Chronic inflammation can also contribute to endothelial dysfunction, causing kind of an endothelial insulin resistance. And atherosclerotic plaque formation these combined leading to hypertension and cardiovascular disease. Altered systemic lipid metabolism can lead to the appearance of oxidized small low density lipoproteins, but also other alterations in lipoprotein metabolism. And this results in increased oxidative stress and inflammation, kind of providing a positive feedback loop to the starting point. This table is highlighted as specific to skeletal muscles, but in fact, most of the points in this one can be generalized to systemic metabolic alterations. For example, the insulin receptor in the signaling pathway, the GLUT4, the glucose transporter changes are applicable to both skeletal muscle and adipose tissues, thereby causing a reduction in insulin-stimulated glucose transport. Decreased glycogen synthase activity is also not only specific to muscles, but the liver is affected with similar physiological changes. The increased reactive oxygen species production occurs in every tissue in the body, which shows signs of insulin resistance. Then the reduced blood flow, the impairment of the action of insulin, which causes a dilation of blood vessels, it's also fairly generic. And the reduced generation of nitric oxide is both organ specific and endothelial wide, so body wide in the endothelium. And then these combined increase vasoconstriction, which can plausibly cause, of course, hypertension. Without going into too much details how insulin resistance can cause hypertension, the main pathways are highlighted. One of the most important are the change in nitric oxide and the blocking the vasodilatory effect of insulin, kind of the endothelial insulin resistance part. This leads to dysregulated renal sodium transport and increased sodium retention. Higher reabsorption will contribute to the pathogenesis of hypertension. Endothelial dysfunction, sometimes also called endothelial insulin resistance, is a hallmark of hypertension because the endothelium, the vascular endothelium, plays a very important role in blood pressure regulation. It contributes basically to all parts of hypertension development, the initiation, progression, and also to the complications. The endothelium is responsible for regulating vascular tone and releases vasoconstrictors and vasodilators, so it can relax the blood vessel, smooth muscles, and it can also constrict. And this is the basic mechanism of the regulation for blood pressure. And this balance becomes disrupted in hypertension, and higher vascular resistance and decreased vasodilation are the most important mechanisms here. And basically, this is it for endothelial dysfunction. And the detailed mechanisms, inflammatory activation and increased reactive oxygen species and decreased nitric oxide. These are closely regulated by insulin. So a vascular insulin resistance gives rise to this inflammatory activation and an imbalance between reactive oxygen species and nitric oxide. And these will increase vascular tone and sympathetic tone, and also increase renal sodium retention by the kidneys, causing a volume expansion and hypertension in the end.
Thank you, Gábor. So that leads us to the role of the kidney in hypertension. It plays quite a critical role because it does maintain blood pressure in the body. So when we look at how the body normally maintains blood pressure, you have the release of renin by the juxtaglomerular cells in the kidney. These are stimulated often by low blood pressure in the body, so they pick that up and they release the renin. The renin is then going to cleave angiotensinogen, which is produced by the liver, into angiotensin 1. That's then going to be converted into angiotensin 2, and angiotensin 2 plays a really critical role in blood pressure maintenance. It has three key actions. The first is going to increase the reabsorption of sodium back into the body by the proximal convoluted tubules, which are in the kidneys. And by doing that, it also reabsorbs water, so it expands the blood volume in the body. So that's one way it can maintain blood pressure, increase the blood volume. It can also stimulate the release of aldosterone from the body, and then that works on the sodium potassium pump by again reabsorbing sodium and releasing potassium, and in the same way it's going to expand the blood volume in the individual in the vessels. And then the third key mechanism is it's going to really stimulate the release of ATP by the hypothalamus, and that's going to sort of stimulate this feeling of thirst, so an individual will want to drink more and more water, and in that way kind of maintaining blood volume. So that's the normal system of what goes on. When there is overactivation of this system, then we can start getting some key issues in relation to hypertension. So when we do get this overactivation, which is called the RAS system, or the renin angiotensin to aldosterone system, we can then get this sort of overactivation, and especially with angiotensin 2, that plays a really critical role in the blood vessels. It can create endothelial dysfunction, inflammation in the blood vessels, stimulating vasoconstriction, and elevating vascular hypertrophy, so just narrowing of the blood vessels, and fibrosis. So all of these key factors on a cellular level are going to increase sort of the flow, reduce the flow in the blood vessels. So it's going to increase hypertension in the body. So there are some scenarios when you can have RAS overactivation. Naturally and normally you can get RAS activation when there's low blood pressure and dehydration and blood loss, but that's just to maintain the kind of blood volume. When we have chronic kidney disease, or when we have narrowing of the blood vessels leading into the kidneys, we can then sort of get this overactivation as the body tries to compensate because it isn't receiving enough blood flow into the kidney. So there's sort of an overwhelming of the system and a reduction in the negative feedback mechanisms. The other way is through insulin resistance. Insulin itself can stimulate the release of renin and sort of trigger this RAS system to start overworking. So a body that has more insulin or is more insulin resistant is more likely to then have overactivation, and other than all the other factors we've already mentioned, can also get hypertension in this way. So the symptoms of hypertension. So hypertension is often asymptomatic in many cases, and especially in the start, so when it's more mild. In some cases, we start to get some minor symptoms, and these can be related to the sheer flow of high blood pressure, high blood flow within the vessels themselves. High blood flow can directly damage the blood vessels, leading to stiffness, narrowing, and weakening of those vessels, and sort of triggering some of these milder symptoms. These can be related to tiredness, headaches, and headaches especially that's reported in the morning. Can also report dizziness and lightheadedness. You can get blurred vision or visual changes, again, because of the blood vessels that are being impacted within the eyes. And you can also get some nosebleeds, and constant or recurrent nosebleeds may indicate elevated blood pressure. There are other symptoms that are sometimes described in literature, things like shortness of breath or palpitations or chest pain, but those are more likely related to progression of hypertension into more cardiovascular diseases, whereas these milder symptoms are more likely to be of early stage hypertension. So how do we diagnose hypertension? One of the easiest and most direct ways is to measure blood pressure in the body. The criteria varies depending on location, depending on individuals themselves and other comorbidities, but the standardized criteria for diagnosing hypertension by the American Heart Association and the College of Cardiology is a systolic blood pressure of 130 over a diastolic blood pressure of 80, and anything above that would be classified as hypertension. However, you need at least 2 readings on 2 separate occasions to truly confirm this diagnosis, and often clinically that could be a number of different readings with a blood pressure diary. The reason we try to have more than 1 or 2 readings is because the body naturally can have elevations in blood pressure in certain situations of stress or even situations of lack of sleep, and these can be more acute causes. And sometimes when you go to the doctor's office, you can have this white coat phenomena of the blood pressure being elevated, so you need multiple readings to really confirm that there is a state of chronic long-standing hypertension. Other labs or blood work can be quite useful just to understand what's going on and if there are any secondary causes of hypertension, and just understand the state of the body itself. Things around insulin resistance or trying to diagnose if insulin resistance is present can be quite critical. So fasting insulin or a triglyceride HDL ratio can give us a better picture of what's going on. Measuring in values for the kidney could also be very important, just so we understand if the kidney is damaged, and then also monitoring with kidney labs over a longer period of time can let us understand the status of the kidney over a longer period of time. And so bloods like eGFR, which is the glomerular filtration rate, can be used, or urine samples such as albuminuria, which is proteins in the urine, can let us know if there's any damage to the kidney. The eGFR, or the glomerular filtration rate, is one of the gold standards for kidney function. Values can decline with age, but the standard is anything above 90 mils per minute would be ideal, and then anything lower than that can be classified into the different grades of kidney disease. Again, these vary with individuals and by age, but having at least the standard can let us know if there is progression over time.
Yeah, that's for me. My favorite as an ex-pharmacist. So we got the classic medications, the ACE inhibitors, as Wafa explained the importance of the RAS system, and most of medications here work on that axis or line. So the ACE inhibitors block the activity of that angiotensin converting enzyme that we mentioned. The ARB blocks the action of angiotensin 2, so lower on the cascade of events. Then we got also the calcium channel blockers, which don't work on that system, but block the influx of calcium ions into the smooth muscles, just reminding that our vessels or blood vessels have this smooth muscle coating. So that causes the relaxation and lowering of blood pressure. Then there are the diuretics, which inhibit the reabsorption of sodium and chloride in the kidneys. So we are working on the kidneys directly and the electrolyte balance to lower blood pressure. And the last one, the potassium sparing one, block the action of aldosterone, which is the last piece in that RAAS system. Let's go on. But obviously, when the body gets blocked in some direction, it tends to react in some other place. We highlighted persistent dry cough was one of my favorites when I used to work as a pharmacist. Why? Because I'm sorry, and I know this is a serious topic, but I used to get patients with hypertensions, obviously, in their baggage of medical history, but then a prescription for a dry cough syrup with codeine or something else. And I would look in the history and pick up the ACE inhibitor and say, well, please go back to the practitioner and say that this dry cough, which is unexplainable because the season is nice and everything's all right, is caused by your medication. So that's one. Or the nice calcium channel blockers, which cause constipation, because we need that gut motility and we're gonna affect it somehow. And sometimes you'll get prescription for something to help with constipation, and we would look again at the file and say, yeah, please go back and reconsider. And I don't want to even touch upon impotence in men and the various requests that I got there. Yeah, so medications are important, especially in acute phases, especially it's understandable, but let's move on to lifestyle interventions, which are preferable if possible. So obviously low carbohydrate diets, even if moderate whole food low carb diet is still helpful. We get to lower that insulin resistance. As we say, it influences directly the kidneys and the blood vessels. I'm a big fan of physical activity. I said it many times. It just hits those blood vessels and helps them. We'll show it better in a better slide. Yeah, avoiding stressful life, improving sleep. It might be like many people think that it's secondary, but sleep just alters the whole metabolic and hormonal processes the next day. When we don't get the right sleep, we'll be craving more stressed. Everyone knows that syndrome, so avoiding that as much as possible. And increased sun exposure is something that we looked into in the nitric oxide production, especially. But also there is the whole aspect of vitamin D that we didn't expand upon this time. Hopefully next time, stay tuned. But vitamin D melatonin balance is also very important. That's why we see maybe a seasonal lowering of blood pressure for some people with the sun exposure coming. So yeah, that's another aspect of lifestyle. Let's go on. So the first, or we mentioned first low carb diet, but obviously the superior in them, or the absolute king, is the keto diet. Really lowering those carbs and high up with the fats would give us metabolic effects already at the microbiome level. Improved cellular metabolism is just more efficient. This will also show later in another diagram. Anti-inflammatory, antioxidant effects, glucose panel is better, lipid panel is better. Direct cardiovascular effects of the keto diet on the endothelial function, nitric oxide production, which, as we said, is a key element, and less oxidative stress and so on. We also get something that is maybe overlooked but not famous here enough in the ketosphere, is that kidney health is directly affected at the gene expression level, kidney function, and also the BHB and modulation of glucose metabolism there has a long way into helping us against hypertension, even reversing nephropathy. Sorry, correct me if I'm wrong there. Okay, that's the diagram promised. Ketogenic diet with the precursors and of ketone bodies coming into the liver, which already at the cellular mitochondrial level makes things more efficient, so less reactive oxygen species, better functionality of the cell, and obviously the tissue following. Here we focus just on the ketone body secretion, but again, something not so obvious, but we get this direct benefit of the ketone bodies on the endothelial blood vessel and the walls, which is the alleviation of the metabolic syndrome, like the insulin resistance there, antioxidant and anti-inflammatory effect. And yeah, well, body weight loss is a result of the long-term adoption of a ketogenic diet, which mechanically already helps us because those blood vessels have to push against less resistance. Yeah, which takes us to the next slide, actually, that we are talking about something that is in its core mechanical. It's a pumping system. And exercise, I love this slide because it says blood flow up, shear stress. It's just so clear mechanically that the exercise just puts those blood vessel in front of life, telling we need more endothelial cell migration down left. Endothelial cells have to get stronger to be able to survive the stress. There is vasculogenesis, modulation of the area. There is obviously the whole nitric oxide and that side of the equation improving. The paracrine effects, inhibition of thrombosis, autocrine effects, which is again the improvement of the cell survival and the reduction in inflammation. Yeah, to be more functional. It's a clear message to the circulatory system, the exercise. Let's move. Disclaimer for patients, obviously. You gotta be careful with everything you do. Keto diet is, as said, is powerful, so it might really get good results quickly. So just check your medications, how they are working out if you are on some of them. As a pharmacist would say, consult your primary care provider. Yeah, hopefully you will not get any hypotension symptoms. Summary: hypertension is a chronic medical condition that results in elevated blood pressures. As we said, insulin resistance lies at the heart of it, both at the kidney level and in the blood vessel level. Reversing that can improve hypertension symptoms and disease progression. And please go opt for lifestyle adaptation and mechanisms such as the low carb to help yourself and try to go through a remission of insulin resistance and improve the blood flow. And good luck. Thanks.
Yeah, thank you very much, Kaled, Wafa, and Gábor, for your presentations. I think you really drove the point home. Certainly for a condition that's affecting nearly half of the US population, it's important to lay out the key contributors to what's causing it. Low-hanging fruit being things like smoking and the standard American diet, but actually understanding the mechanisms at play, I think, empowers people to understand why these interventions are so effective. A personal favorite aspect of the presentation for me was Kaled's emphasis on the potential acute benefits of some medications. I always like thinking that if I break my leg, I don't necessarily want to go to a nutritionist. There is a real case for acute care versus chronic disease management. And certainly medications have their place for people in their short-term medical care. But things like smoking cessation, more exercise, more time spent outdoors, these at face value, if said to a family member or a loved one, may incur some eye rolling at how simple they seem. But the pathophysiology is remarkably important in understanding why something like a low carbohydrate diet can help address the root cause of the problem and avoid all of those nasty side effects that Kaled was pointing out that he experienced in his previous career. Kaled, a comment?
Yeah, it just reminded me, extra point, smoking, so your nicotine, and just people tend to forget that caffeine is a stimulant, and you gotta be careful with that. Licorice was mentioned, so even small things can, especially if used daily, play a huge role in this. So yeah, just be careful out there.
Or increase your general sympathetic tone for somebody who's already in a fight or flight state. Generally, for career or familial stress, it could certainly exacerbate the problem. But yeah, thank you all for your time. I hope this was illuminating for hypertension as it relates to chronic disease and lifestyle changes. And we'll see you in the next video. Thank you very much.